Today we will talk about ACL surgeries. And what is ACL? ACL is anterior cruciate ligament. It is basically ligament inside your knee joint that connects the femur bone above and the tibia bone below. And ACL tear is usually a sports injury, which means you can have an ACL tear when you're playing basketball, when you twisted your knee while playing cricket, or while doing high jump, long jump, or for that matter any form of sports injury. But in southern part of India, where the culture of sports is not as much as compared to the northern part of India, ACL tears can happen in roadside accidents. ACL tears can happen when you have twisted your knee while getting down from the stairs. ACL tears can also happen by simple twisting injuries in an overweight individual. So yes, ACL tears are also classified as sports injury, but in this part of the country, ACL tears can happen due to accidental twisting of the knee joint. Whenever the ACL tear happens, X-rays usually don't reveal any abnormality, and most patients are told by a local doctor that your X-ray is fine, but there is swelling, there is pain, and patients start to experience what we call as instability. So what is knee instability? Knee instability means your knee is not feeling that confident. Your knee is loose when you walk faster or when you turn while walking faster. You don't feel that stability inside your knee joint and your knee feels like giving away. That's when I recommend an MRI to the knee and we see what is happening inside the knee, and usually it reveals a complete ACL tear or a high-grade partial thickness ACL tears. So these ACL tears do not heal, unfortunately. They need to be reconstructed or repaired depending upon how the tear is, depending upon the pattern of the tear. And ACL reconstruction surgery is a small surgery done in 35 to 40 minutes. It is done through keyholes and small cuts. We don't open the entire knee joint to do this kind of an operation. It is done in small time, 35 to 40 minutes. The patient can go back home the same day or the next day. The patient needs to wear knee brace for about 4 weeks after the surgery. The patient can walk the next day after the surgery. It is a very rewarding surgery. Within 35 to 40 minutes, you can get back that stability inside the knee joint, and within 6 weeks, the patient can go back to his all routine regular activities. There is no bed rest with this kind of an operation, and if the patient is a sports player and if he wants to go back to sport, the patient can also go back to sport within 6 months of knee ACL reconstruction surgery. We use a very latest kind of implants for ACL surgery, which means we do all inside ACL reconstruction. So with the previous generation ACL surgery, we used to use a button and a screw, but now we got over the screw system and we're only using small titanium buttons to fix the graft on the femoral side and the tibial side. So the recovery is very quick and the strength and the stability of the graft is also very good. And with all inside ACL reconstruction surgery, the bone sockets are also smaller, and that's why it is a bone conserving surgery. We don't drill the bone through and through, and rather drill the bone in small sockets, so we preserve the bone, and that's why the pain also is very less with this kind of all inside ACL surgery. Thank you very much.